How do you manage? I know something of your work schedule. You've
Yeah.
got an event coming up on May the 12th that takes an awful lot of preparation. You work with a lot of other people. How do you handle all of this? What
I
kind of
follow,
support do you get, I
I
suppose?
follow all of the advice that I give to my patients.
Hmm.
And I think I'll get a chance a bit later to talk about my manual. So all that advice is in writing in my manual. I've tried to kind of put it in a organized manner so that it will be helpful to others. And
Hmm.
it's a lot of the stuff that you talk about, Jerry, in your book. If you don't eat right, your body won't have the energy to cope with this illness. You have to pace. You have to set priorities and let some go. You have to sleep enough. You have to avoid unnecessary chemical exposures if you have the MCS component. You have to manage your life stress. Those are all chapters in the manual. So you have to pace your activity and exercise. So all the things that I preach to others, I've learned many of them through personal experience. And by following those guidelines or that learning over time, that's enabled me to keep functioning. I work part-time. I work about half time.
Hmm.
But as you say, there's a lot of overflow. I work about 20 hours a week with patients, but then there's organizing events and participating in research and doing interviews and writing papers and all those other things that I do to try to help advocate for my patients.
And one of the things that these diseases affects is your mental acuity, brain fog, whatever you want to call it. So you're doing all this research, you're doing all the writing, you're doing all the speaking, you're doing an interview like this. All of these things are very, very difficult for patients, including yourself.
Cognitive function is impacted, and again, I've learned a lot of strategies to cope with that. So to compensate for poor memory, I take copious notes. For example, when I'm meeting with a patient, I write a very long consultation note after the initial assessment process. It's usually about 10 pages.
My gosh.
And I do that partially for the patient so that they'll have a really good record of their health status, but I also do it for myself so that when they come back a year later and I can barely remember, the details of their situation, I have really good notes to go back to. I'm very organized.
No,
So there's a lot of skills you can learn to kind of help compensate for that pure memory.
and your manual helps them understand some of that.
Yes.
I recall attending one of your seminars, I think it was way back in 2008, in which exercise was discussed. And that's a really difficult one because I know a lot of patients are told by friends, relatives, husbands, wives, and doctors, get more exercise. And that's a real tricky thing. And I suspect you cover that in your manual.
I absolutely have a large, one of the longest, I call them sessions because it's actually exactly based on the sessions we do in person in the groups that I facilitate. So I've got a whole session on activity.
Okay.
I talk about a lot of myths. So there's a lot of myths out there. One of the myths is exercise is good.
Yeah.
Right? Blanket statement for everybody. And I talk about, well, while exercise is good because it's necessary to help you maintain fitness and mobility, there's a very particular way in which you need to do it if you have ME/CFS, and I give the details of that in the manual.
Good. Well, I'm glad to hear that. While we're talking about your manual, how do we get a hold of it?
Well, I'm so glad you asked that, Jerry. I'm gonna flog it here.
Okay.
So that's what it looks like.
All right.
And it comes in a virtual version, so a download and various paper versions.
Excellent.
You can order it off my website.
Let's shift then from the patient to what you and they in general are asking for support for. Are you asking the government? Are you asking the medical profession? Are you asking anybody for anything special that somebody else with a disease is not asking?
I don't think so, Jerry. I think what we're asking for is to just have equal access to good quality health care within the Canadian healthcare system. So as it stands right now, a lot of the diagnostic tests, for example, that are routinely used around the world are not available in the Canadian healthcare system. So we're asking that, just a couple of those tests that are showing pretty good reliability over time be available to patients who don't have means. So at the moment, many patients avail themselves of those tests, but they have to pay for them up front. And it would be great if the provinces could pick up that bill so that all patients who were suspected of having ME/CFS could get clarity about their diagnosis.
What can, as though they need something else to do, but what can patients themselves do to support people like yourself in asking for those things?
I would say this is kind of an exciting time in the field because the amount of research going on is substantial, and I think we're making some pretty big gains. So I feel like this is kind of a watershed moment where we've got enough science that it's now possible to go to governments and say, here's what we know about this illness, and this is the best way to manage it, and we want programs, we want, my big plea and what I've been working on for 10 years is educating my colleagues. So educating healthcare professionals that this illness exists, that it's serious, that it's not rocket science to diagnose. There's actually, I mentioned yesterday, there's checklists. It can be diagnosed just like any other condition. So that when people go into a frontline healthcare worker, whether it's a doctor, nurse, physio, OT, dietitian, kinesiologist, doesn't matter, that the person will know what the illness is and they'll know what it means if the patient comes in and says, I have ME/CFS. And then if they're a doctor or a nurse, that they're going to know what are the accepted management protocols out there.
Do medical people come to your workshops and seminars? Do you see a turnout?
Yeah, absolutely. I've been giving talks through the University of Calgary for, 5, 6, 7 years, and the turnout is good. I get excellent evaluations. I think, partially it may be because I'm a good speaker, but partially they're obviously appreciating the information or they wouldn't give it a good rating. Yeah. I mean, some other things that are really critical for the severely ill. I mentioned earlier that the severely ill are especially disenfranchised because they're often too ill even to go to a doctor. They might just not have the energy. They might not be mobile and they might not have any way to get there, or they might have MCS and so they can't go in a place that's kind of smelly like a doctor's office. So for many reasons, about 25% of sufferers really are getting almost no medical care at all, and they're the most severely ill. So one of the lobbies is to get in-home services for those people. And again, we're not asking for anything special. Those services already exist, for example, for people in palliative care. So the model is already there. We're just asking to have access to those existing models.
When somebody is so disabled by any disease, they're the last people who know how to go out and ask for help in an articulate, cogent, clear way. And they're the last people to be listened to, ironically. So your manual, I suspect, is really important for the couple, the friends, the family, not just for a patient or just for a doctor. People need to know how to help others.
My hope is if a patient shows this manual to their friends and family, it will give some of what they've been telling them credibility to see that a physician actually agrees. And I should say the manual is heavily referenced. There's hundreds of references to peer-reviewed medical literature. So the manual isn't just my personal opinion. It's actually what we know, the accepted knowledge in the field. I just wanted to say, Jerry, I kind of haven't answered your question about how people could get involved.
Yes.
And I would say the best way to get involved on a political level is through the National ME/FM Action Network. They are kind of the top of the pyramid in terms of advocacy in Canada, and they have provincial and local affiliates. So in many provinces, for example, Ontario has an organization very, very active and effective called the MEAO, Myalgic Encephalomyelitis Association of Ontario. It's a bit of a mouthful.
Yes. How long did it take you to get that down so smoothly?
I've been saying it for years. Repetition is good. So British Columbia also has a very strong provincial support group, and they've been contributing. You know, they've been in a position to contribute and give input to this new BC Center. So if you contact the national group and let them know that you want to help, they have many possible ways to help that include more or less commitment, more or less knowledge. And I've watched people, you know, over the last 10 years join that group and slowly increase their expertise and their effectiveness as an advocate. And now they're, you know, at national meetings, for example, to advocate for better research, for more research funds for these disorders. So I can see the growth of advocates. So it's not only getting the job done, but there's kind of personal skills to be gained in the process, and really good friends.
What kinds of things can patients and their families, if they have them, and I know there are an awful lot of single people out there who try to cope on their own. I can hardly imagine that. But let's talk about families. What can they do on their own to soften the impact of all these diseases, right at home, on their own?
I think a real key is validation by the family members. So the ongoing communication from the patient to the family members, letting them know their experience. I think some patients really vary in how much they communicate their experience to those around them. Some people feel maybe they haven't fully accepted that themselves, and they feel a little bit of shame or guilt that they have this condition, and they don't want to whine and they don't want to be a burden, and they kind of keep things to themselves. And while that may sound admirable, the side effect of that is that the people around you really don't know what you're experiencing because you're not telling them. So I think figuring out, it's going to be different in every family, figuring out how to communicate kind of in a positive manner, but a realistic manner, what you're going through, and then negotiating with your family members, because unfortunately it means that some of your tasks and roles are going to fall on others. It's really the only way to accommodate this severity of illness. People can't keep going the way they've been going. That's almost never possible. So the only way that it's going to get better is if there's some pretty open discussion within the family about how other people can pick up the slack. And I would say if people can afford it, how to pay others to pick up the slack so that it doesn't all fall on the family members.
Don't imagine there's much in the way of government subsidies or help or insurance help for getting that kind of support, is there?
As far as I know, there's nothing. So you're on your own. There's a little bit of help for the most severely affected. So if you're literally a bedbound patient, then you can access, I would say in most provinces, some access to kind of home support services. But I would have to say in my practice, it's literally like 3 people. And I have many patients who just literally are not coping at all. Their place is a mess. Their laundry isn't done. Their food isn't cooked. Their showers aren't being taken, and they can't access home support services. It's a huge problem.
What do we all do next? What do you want us to take action on?
Well, some of the points I've already made, and I think the most effective way in Canada to make change is, again, to network through the existing advocacy groups out there. And I just can't, respect or praise enough the efforts of the National ME/FM Action Network. What they've accomplished with a very few not entirely healthy volunteers has been nothing short of phenomenal and really a game changer in the field. So I would say anybody who wants to make change, even at the local level, should contact that group to get advice and support on how to then make that change. I've identified 5 areas, and I've worked on this with a bunch of people. It's education of healthcare providers, services for the severely ill, implementation of assessment tests and tools, so like diagnostic tests, designated research funding to make this a priority, not I don't really understand it, so I'm not going to approve this research idea. And then development of more centers of excellence, like the one that we've now got in BC. Okay. Those are the 5 areas I see that could really move this field ahead.